You know why they can't help you with your adrenal glands? Because they don't know how to measure it. They can't do the laboratory values for it.
You can measure adrenal gland function. I'll show you the tests that will reveal adrenal gland function, but first, let's take a little look at anatomy. When you look at the adrenal glands, there's three different layers. The outer layer is responsible for aldosterone, blood pressure control. The middle layer manufactures and secretes cortisol, very important as a stress hormone and also to increase blood sugars during times of stress. And then the inner layer is responsible for the production and secretion of androgens like testosterone and also your three different estrogens. Then you have the inner layer or the neurological layer, and this is responsible for the release of adrenaline. Very important for a fight or flight response. So can you measure these on tests? The answer is yes. Here's a test looking at adrenal function in urine. You can measure your cortisol, you can measure your circadian rhythm, you can measure cortisol-cortisone balance, you can measure DHEA. You can also measure your androgens. This is why you can look at testosterone. You can look at your three estrogens on a urine test, known as the Dutch test. In addition to that, well, you can also measure cortisol and DHEA, and you can measure that within the blood. There's a lot of doctors out there promoting adrenal fatigue. Adrenal fatigue is really adrenal downregulation. The adrenal gland is responding to stressors, especially immune system stressors. There are cases of adrenal insufficiency. Primary adrenal insufficiency, it's known as Addison's disease. This is an autoimmune reaction in which the adrenal gland has been destroyed by the immune system and can no longer keep up with hormone production as it progresses to a certain point. Secondary adrenal insufficiency means that it's not happening at the adrenal glands, but it's happening somewhere else. One of the reasons why you can have secondary adrenal insufficiency is you can have a pituitary tumor, like this person, in which case it was a referral to the medical doctor. But the biggest reason why there's adrenal insufficiency is actually iatrogenically induced, meaning it's physician-induced, it's doctor-induced by prescription medications. These medications, dexamethasone, hydrocortisone, and prednisone, these are things that doctors give you in order to knock out the immune system because there's some kind of massive inflammatory response that's taking place inside of the body. This is why people who have autoimmunity also will have things like low energy and fertility problems. What's also interesting too is that actually before a doctor is prescribing any kind of levothyroxine, they actually should be running a cortisol test to see if they do in fact have any kind of adrenal insufficiency. Because if a patient does have adrenal insufficiency and you're prescribing levothyroxine, you can put them in an extreme health crisis. Maybe you learned something from us. Maybe it changed your perspective. I hope it did, but I doubt that it will, especially when you celebrate the death of the founder of chiropractic. Not a good look.